Greetings from Costa Rica. I hope you're doing well. It's June 10th, and unfortunately, we have some bad news to report. A big spike in COVID-19 cases has everybody worried. I want to provide some context and give a few reasons why I'm not panicking just yet. Hello from Costa Rica. My name is Matt Rosensteel. I work with Coldwell Banker Tamarindo Realty here in Guanacaste. If you have any questions, feel free to email me. I'll be happy to help in any way I can. Yesterday, June 9th, we saw our largest single-day increase of COVID-19 cases since the first case came to Costa Rica in March. 86 people, new cases, tested positive for COVID-19, which was very far above the previous single-day record, which was only 55. What's going on here? Well, I want to provide some context and give a few reasons why I'm not personally panicking just yet. First of all, it's important to understand what's happening in Nicaragua. From the beginning of the pandemic, the government there was very clear that they were not going to shut down the country. They said, we do not have the luxury of being able to shut down our country. People will starve, we can't keep services going, etc. It is the second poorest nation in Latin America. So their economy has stayed open, schools have stayed open, the government even staged a rally at one point encouraging people to get together. And so epidemiologists, experts on the subject, have said for a long time that Nicaragua was going to have a runaway inflation of infections. Many were predicting that it would peak the infection rate in about mid-June. Well, Costa Rica and Nicaragua share a border. It's a very important economic relationship. Lots of agricultural workers come down to Costa Rica from Nicaragua, not to mention workers or people looking for jobs, money, etc., of all kinds. Despite the fact that the border has been closed, transport has continued, and of course there have been many border crossings that were not done legally. So anyhow, with the infection rate peaking in mid-June in Nicaragua, a lot of the new cases we are starting to see are foreigners in Costa Rica. Since the pandemic began, we've had a total of 1,461 cases in Costa Rica. I would say up till now, about 350 of those have been foreigners. Now that includes Nicaraguans, Panamanians, US, Canadians, etc. But I would bet that in 2 weeks, the percentage of COVID-19 cases in Costa Rica that are attributed to foreigners is going to increase because of that dynamic. Second of all, and perhaps more importantly, just like a lot of countries around the world, Costa Rica has been reopening slowly ever since late May, now heading into June. They've started easing restrictions. Whereas in March, April, and the early parts of May, Costa Rica had one of the most thorough lockdowns in place that I think anywhere in the world was implementing. With the easing of restrictions, there has been more movement. Businesses are opening up. The economy is restarting. And of course, infections are going to increase as things happen in that direction. A few things that give me a lot of hope are the fact that only 12 people have died so far from COVID-19 here in Costa Rica. Currently, there are only a few people in intensive care with it. We're pulling for them, and only, I think, 10 or 11 people are hospitalized, but not in intensive care. So at least at this juncture, today is June 10th, the national health system is not being horribly stressed by an influx of patients. Another thing that gives me a lot of hope is that Costa Rica's government has been super thorough in tracing cases and working to contain the spread of COVID-19 from the beginning. There are stories of foreigners who were able to fly in here because they're residents, health workers showing up at their house, their rental, to be able to double check their tests, make sure they were following up on every lead. And in virtually every case, the Costa Rican government is really trying to do a lot of contact tracing and they're being super aggressive about this. They're also backed by a health ministry that has tentacles into almost every, really most communities that are larger than a few hundred people in the country. You see that there's a local system of health clinics, then it goes up to a regional level, and really Costa Rica's substantial investment in a health system, I think, prepares us to at least be able to monitor, contain, and deal with this. Another reason I'm not too worried is simply the population density of where I live. Guanacaste province in the northwestern part of Costa Rica is a rural area. Of 1,460 some cases in Costa Rica to date, only 60 of those have been in Guanacaste. This is a place where it's pretty easy to isolate yourself, quarantine yourself. The social distance between people in this area is normally a lot larger than what you would see in urban areas. And so far, the vast majority of cases here in Costa Rica have been concentrated in the densely populated Central Valley, and also now we're seeing more and more cases up north because of the interaction with Nicaragua. I'd put together a video on healthcare here. If you're looking for more information on that, I'll put a little card up here in the video. My name is Matt Rosensteel. Again, if there's anything I can do for you, any questions I can answer, feel free to send me an email. Thank you very much for watching, and have a good day.